You know that feeling, right? Chest pain, it immediately sets off alarm bells. But what if that pain isn't a heart attack, but something else? A warning sign. That's exactly what we're breaking down today. Angina pectoris. It's the heart's crucial cry for help before any permanent damage is done. Okay, let's get into it. So this is the central question, isn't it? The one that causes so much anxiety. Is this pain I'm feeling just a warning, or is it the real deal? Understanding that difference is absolutely critical, and it all starts with figuring out what angina truly is and what it isn't. So the official definition is chest pain from transient myocardial ischemia. Now look, the most important word on this whole slide is transient. It just means temporary. The blood flow to the heart muscle gets squeezed down for a little while, but then it comes back. And that makes it fundamentally different from a heart attack. And that brings us right to our first major point. You have to think of angina not as the disaster itself, but more like the flashing red light on your car's dashboard. It's warning you that the engine's in trouble and it needs your attention fast. And here is the high-yield takeaway. This is the part you really have to remember. In angina, there is no permanent damage. The heart muscle cells, yeah, they're starved for oxygen and they're hurting, but they do not die. That's why we say it's reversible. This is the single most important difference between angina and a full-on myocardial infarction, a heart attack, where cell death is permanent. So, what is actually causing this pain? Let's peel back the layers here. The best way to think about it is as a simple energy crisis happening right inside the heart muscle. It's a classic imbalance. It really all boils down to this simple balance. Oxygen supply versus oxygen demand. Supply is all the oxygen-rich blood that your coronary arteries deliver. Demand is just how much oxygen your heart muscle needs to do its job of pumping blood to the whole body. As long as these two are in balance, everything's great. The trouble starts when they get out of whack.
So, how does the supply side get messed up? Well, the most common culprit is atherosclerosis. That's a gradual narrowing of the arteries from plaque buildup. But it can also happen because of a sudden artery spasm or even a small blood clot getting stuck. Essentially, the pipes delivering the fuel are getting clogged.
Now, let's flip to the other side of the equation. What makes the heart demand more oxygen? Well, pretty much anything that makes it work harder. Physical exercise, a super fast heart rate, high blood pressure, even intense emotional stress. All of these things put a bigger strain on the heart, and that means it needs more fuel. And here's where it all comes together. When the demand is way higher than the supply, the heart muscle is forced to switch to its backup energy system. It's called anaerobic metabolism. The problem is, this backup process creates byproducts like lactic acid, and that stuff irritates the nerve endings in the heart, and that irritation, that's what you feel as chest pain. It's a direct signal of that energy crisis. Okay, but here's the thing. Not all angina is created equal. The pattern and the trigger of the pain can tell us a lot about what's really going on, which brings us to the different types of angina you can have. This table is a fantastic exam point comparison. First, you have stable angina. This one's predictable. It's caused by a fixed narrowing in an artery, and it pops up when you exert yourself, like climbing a flight of stairs, and then it goes away when you rest. It's a warning sign. Now, unstable angina, that's a whole different story. This is a medical emergency. A plaque has ruptured, a clot is trying to form, and the pain can hit you even when you're just sitting at rest. It's unpredictable and a huge red flag for an impending heart attack. And finally, there's variant, or Prinzmetal angina. This one's the oddball. It's caused by a sudden spasm of the coronary artery, and it often happens at rest too. So, with all these different flavors of angina, how do doctors actually figure out what's going on? Let's walk through the diagnostic pathway. The workup usually follows a pretty logical path, starting with the least invasive stuff. First up is the ECG, the electrocardiogram, which just records the heart's electrical activity. Now, it might look totally normal when you're resting, but it can show some key changes during a pain episode. Second, they'll run blood tests to check for specific cardiac enzymes. Third, if it's still not clear, comes a stress test. This is where they safely make your heart work a little harder to see if they can reproduce the symptoms and the ECG changes. And finally, the gold standard for diagnosis is a coronary angiography. This is basically an X-ray movie of your heart's arteries, and it lets doctors see any blockages with amazing clarity.
And this right here is a massive clinical tip. Those cardiac enzymes we just talked about, they're proteins that get released by dying heart cells. Since no cells are dying in angina, those enzyme levels will be totally normal. If they are elevated, the diagnosis changes on the spot. It's no longer just a warning, it's officially a myocardial infarction.
So what does this actually feel like? Well, the classic description is a pressure or squeezing feeling right behind your breastbone, and it usually lasts less than 20 minutes. That pain can also travel or radiate, most famously down the left arm, but it can also go to the jaw or the neck. And it's often accompanied by other fun things like sweating or feeling short of breath. Okay, so once angina is diagnosed, what's the game plan? Well, it's pretty simple, and it brings us right back to the beginning. We've got to get that supply and demand equation back in balance. The whole management strategy really rests on three main pillars. First, you've got to provide immediate relief when an attack is happening. Second, you need long-term therapy to stop attacks from happening in the first place. And third, for really severe blockages, you need procedures to physically restore the blood flow, a process we call revascularization. For that immediate relief, the go-to medication is sublingual nitroglycerin. It's a tiny tablet you put under your tongue, and it works within minutes because it's a powerful vasodilator. It basically just widens your blood vessels, which immediately boosts the oxygen supply to the heart, fixes that energy crisis, and makes the pain go away. Now, for the long game, prevention is a multi-pronged attack. You've got drugs like beta blockers that reduce the heart's workload, which lowers its oxygen demand. Then you have other meds like aspirin and statins that work to stop the underlying atherosclerosis from getting any worse. And, of course, lifestyle changes. A healthy diet, regular exercise, and quitting smoking are absolutely non-negotiable. All right, we have covered a ton of ground. So let's boil it all down to a quick, high-yield summary of the most important things to take away from all this. First, angina is ischemia, oxygen starvation without necrosis or cell death. Second, stable angina is predictable. It's brought on by exertion. Third, unstable angina is a medical emergency that happens at rest. Fourth, nitroglycerin gives you fast relief because it cranks up the oxygen supply. And finally, number 5, the whole goal of treatment is to fix that supply and demand imbalance.
Which really leaves us with this one final thought. Angina isn't the final disaster. It's the urgent message being sent from an organ in serious trouble. It is the heart's cry for help. And the real question is, are we listening and taking action before that warning cry becomes a final silence?